So in 2018, OSAP, which is an organization that focuses on infection control in the dental industry, released a paper talking about dental unit water lines. There's a lot of information, but we'll just go through some of the bullet points of what they gave us. We want to ensure that we're reducing the bacteria levels to as low as achievable. We also need to be wary of boil water advisories, especially if we're using the city water. Use only sterile irrigation and coolant for surgical procedures. We also need to stay informed about current recommendations and contaminations. We need to flush lines for 2 minutes before patients arrive and 20 to 30 seconds between the patients. Follow the DFU and review information on the product selected. So action has to be done at 500 CFUs, stated by the CDC. There's no exception about that. The CDC is the one that puts that limit into place. But we shouldn't be waiting until we get to 500 CFUs. If we see something at 250, we know that there's a positive growth going on. So we want to take action at 200 so we don't get to the failure point of 500. We also need to understand our testing method and the science behind it, and the benefits and the limitations. But again, we don't want to initially test for specific organisms other than Legionella itself. The dental care team needs to monitor quality of water and document test results. Develop a protocol for waterline maintenance and monitoring. Educate the team members on maintenance and monitoring protocols. So how many times should we be testing? With a new system, we need to review the DFU. We need to know what the protocols are and how we want to monitor that. Well, OSAP says that we should be testing monthly for a good trend. Well, what's a good trend? 2 good months can equal a good trend. After that, we need to go into quarterly testing. There's no reason that we need to continue to do monthly testing if we have a good trend. But we do want to ensure that quarterly testing is in place for these units. Too much can go wrong with systems if not monitored quarterly. We need to ensure that throughout the year we have at least 4 good tests. And then if we do find a failure, we might need to go back to monthly testing until we get those good trends. Again, if you do fail, it's simple. We need to shock and retest and maybe look at different solutions to ensure that our water lines are staying under that 500 CFUs. And that's where the protocols come into place. We want to make sure that we follow those throughout the whole process. Units that have intermittent use may require more frequent testing. Again, if we have a backup handpiece that doesn't get used very often, we need to ensure that biofilm is not building up. So we might need to test that more regularly than all of our other lines. But if you want to see this more in depth, please go to OSAP and look at the information that they have on dental unit water lines.